Hello, welcome back to my YouTube channel. Myself, Dr. Rocha. I'm introducing myself for those who are visiting my channel for the first time. We've been making videos on different types of mental disorders. And last video, we have discussed about different types of dissociative or conversion disorders. Now, in this video, I would like to discuss about nursing management of dissociative or conversion disorders. And before I could proceed, I would like to request you all to please subscribe and share my channel to others so that they would be of some information to them. So if you remember, in our previous video, we have discussed that dissociative disorders are mainly caused due to some stressful events or some abuses or whatever it is. There is a disassociation where the person loses a part of memory, is lost from the conscious awareness of a person. And we have discussed about different types of subtypes like dissociative fugue, amnesia, then hysterical fits we have seen, trance and possession disorders, multiple personality disorders, dissociative anesthesia or sensory loss. So if you haven't seen, please go back and see that video before you could come to this video. So coming to nursing management part of it, first comes nursing assessment. We need to assess for behavioral changes such as degree of orientation in the person. Why? Because in dissociative identity disorder, we said that person loses identity. Dissociative fugue, we said because he loses his identity, he just moves away from that place and goes somewhere, creates new identity. So we need to have an idea on degree of orientation. We need to do complete mental status examination for that person. Then next, assess the level of anxiety which is present in the person, possible coexistence of depression, degree of impaired social functioning or occupational functioning, then any history of suicidal gestures or self-mutilation. Why suicidal gestures? Because they lost their memory. They are not able to recollect some part of their life, some events which have occurred in their life. As a result, they get stressed, anxious, and they may try to harm themselves also, or they may try to harm others. We have to assess in regard to that. Next, other psychiatric disorders. So it is difficult to differentiate from dissociative disorder, but we need to do complete mental status examination. We need to utilize some of the psychological tests to come to a conclusion with what the person is exactly suffering, whether there are other comorbidities which are present in the person. Then after nursing assessment, we will have our nursing priorities. First one is to provide safe environment for the person. To protect the person from doing harm to himself, at the same time protecting others from the patient who is trying to harm. Next, assist client to recognize anxiety. Whatever is causing anxiety in the person, you need to assist. As a nurse, how can you assist? Encourage person to verbalize one-to-one, display, show confidentiality, help the person to build some trust in you so that he will be able to verbalize himself, or refer to psychotherapist where they can use this free association, what has been said, abreaction therapy or hypnosis. Next, promote insight into relationship between anxiety and development of dissociative state or personality. So after getting the information or after understanding what is causing them lot of anxiety or having information related to some stressful events what has occurred in patient's life, then you have to connect between these two. Your behavior at present, is this because of this? We need to help them to identify how that stress is causing the symptoms in present situation. Then the fourth one is support client and family in developing effective coping skills and participating in therapeutic activities. Now coming to nursing diagnosis. The first nursing diagnosis will be disturbed thought process related to severe psychological stress and repression of anxiety as evidenced by loss of memory. Disturbed thought process, mainly related to what? Psychological stress. So repression of anxiety, as a result dissociation or conversion. So which now in this case evidenced by loss of memory. Dissociative amnesia, we can write this nursing diagnosis. So our interventions will be obtain information about client from family and significant others. Expose client to stimuli that represent pleasant experiences from past, such as activities, pets, music. So what we are trying to do, we are going to expose the client to his past activities which bring pleasant experience, not traumatic events. Okay, so these memories will bring, these events or this stimuli will bring back his past. Okay, encourage to discuss stressful situations which he has faced in life, then associate with the feelings already explained, then identify the conflicts the person has been going through and the conflicts which are not resolved. Ask the person certain problems he has faced which he haven't found solution. Now after identifying what are those, we need to help him to identify different possible solutions for that problem. Then provide instruction regarding more adaptive ways to respond to anxiety. What are some of the more adaptive ways to respond to anxiety? Problem solving method is one thing, meditation, relaxation techniques, yoga, biofeedback. So these are some of the more adaptive ways. Our next nursing diagnosis is powerlessness related to inability to cope effectively with severe anxiety as evidenced by verbalization of frustration or lack of control depending on other persons. Here, the person is having a lot of frustration, severe anxiety is present. So there are certain chances where he might harm himself also. Okay, apart from that, he is feeling hopeless, helpless, powerless. So we need to improve the self-esteem of a person, that he can do some things, he has capacity to gain control over his life. So what would be our nursing interventions? Allow client to take responsibility for own self-care practices, provide feedback on any decisions made by the client, involve client in making decisions regarding client care, then refrain from attempting to influence him or her toward those that may seem more logical, and assist client to set realistic goals for future. So that when we say realistic goals, those goals which are achievable, where a person reaches to where a person can achieve the goal, as a result can enhance his self-esteem. Help client identify areas of life situation they can control. Certain things are there within our hands, of course certain things are there which are out of control, but we have to help client identify what is there within his or her control. Also help them to identify certain things which are not within their control. Encourage the client to verbalize his feelings regarding the situations where he is not able to control. Then identify activities in which client can achieve and encourage participation, provide positive reinforcement for participation as well as achieving certain things. Encourage participation in supportive self-help groups. Next, coming to the other nursing diagnosis, risk for others directed violence related to fear of unknown circumstances. When we say violence, others directed violence, the main thing is we have to do mental status examination, maintain low level of stimuli, very important. See that the environment is free from distraction. Low level of noise, simple decor, few people, low lighting. We need to observe client behavior closely. Remove all dangerous objects from the client's environment, like any sharps, ropes, bottles, belts, etc. Then redirect the violent behavior of person by diverting the person into like doing some gardening or punching bag or outlet, physical outlet. Next, whoever is the staff approaching the patient, they should have a calm attitude and consistency should be maintained. They should have enough staff along with them to show their strength in case the client has an intention to attack. Then administration of medication, tranquilizers like benzodiazepines as said, and monitor the effect and side effects of the medication. Next, coming to another nursing diagnosis like ineffective coping related to severe psychosocial stressors and depressed severe anxiety. Ineffective coping. So, some of the nursing interventions are reassuring the client of safety and security through your presence. So, because these dissociative behaviors, they cause frightening to the client, identify what is causing stress. Precipitating factor needs to be identified. Then explore the feelings or the experience what person faces when he recollects the stimuli or a precipitating factor. Help the client to explore his feelings and the relationship between the precipitating factor, whatever is causing severe stress, and their current behavior. Then providing non-threatening environment to the client and helping client to understand that these repressed traumatic events can cause chronic anxiety in the person. Educate the person on more adaptive coping strategies. Make suggestion, show some possible solutions, and explain about advantages and disadvantages for each solution. Give client an opportunity to choose which is the best solution for him. That's then when ask the client to implement that, and when the client implements and achieves, just provide positive reinforcement. And we need to identify the community resources which are present when the person goes back into the community setup. Identify certain support systems which can help the client. So these are certain like nursing interventions we can do for ineffective coping. Next, coming to disturbed personal identity to childhood trauma or abuse. So when we say disturbed personal identity, it is like multiple personality identity disorder. Multiple personal identity disorder, where more than one identity is present in the person, and the person really does not know that these many identities are present, because each time only one person, one identity is projected. We can call it as multiple personality disorder also. So here, if a person is having this, apart from the above nursing diagnosis and interventions, we can do this also. Help the client to understand the existence of subpersonalities which are there in him. Then help client to identify stressful situations that precipitate transition from one personality to another personality. Carefully, nurses also need to observe and record these transitions when they are occurring, in what situations have triggered this event to occur. Then how to deal with maladaptive behaviors which are associated with this subpersonalities. For example, if one personal is suicide, then we have to see that the environment is non-threatening, non-harmful environment. See that the client does not do harm for himself, or he does not do any harm for others. If the other personality is aggressive type of personality, you should see that this person, same person, does not harm others. So others need to be protected. So apart from that, we need to help serve personalities to understand that their being will not be destroyed, rather than integrated into a unified identity within the individual. So we should tell, we like, as we treat the person, as we talk to the person, it's not our intention that we want to just pull one type of personality out of that person. It's not that. But the symptoms, aggravated symptoms, need to be controlled. So we need to explain to them in a clear way regarding this. Provide support during disclosure of painful experience and reassurance when client becomes discouraged with the lengthy type of treatment. So I hope you have understood like different nursing interventions we need to do based upon the different nursing diagnosis for dissociative or conversion disorders. Coming to evaluation part of it, we assess for degrees of dissociative episodes, improvement in the level of functioning, social functioning, and see that they are able to cope up with the situation, utilize support systems, and we need to assess whether their anxiety has been reduced, and they are able to cope up with daily living activities. All this needs to be evaluated individually. I hope you have all understood this video, and I hope you will be able to write this nursing management of dissociative disorders once you are asked in your examination point of view. And if you have any doubts, please leave a comment in comment box section. And that's all for now. Before leaving, please do subscribe and share to others. We will be coming with more interesting videos regarding other disease conditions in mental disorders. Thank you all very much. We'll end the video for now. Thank you. Thank you all.